Hey guys, good morning and welcome to my channels. My name is Violet Okolocha. How we all doing? I know we are all fine. Guys, I'm super excited because of you guys. Thanks for your support. Your support is massive. Thanks so much for supporting me. I just can't believe we've hit over 1,000 subscribers in just 4 months. So guys, thank you so much, nurses. I really appreciate. So yesterday I said in the community, I'm happy with your support. So if you have anything at all you want me to talk about, just pop it up and I'll be happy to talk about. So the first comment was on ectopic pregnancy and congestive cardiac failure care plan. So guys, we'll be doing that today. But before we go ahead to do it, if you have not subscribed to my channel, guys, your encouragement is needed. So please kindly subscribe. Feel free to like, feel free to share this video with your friends preparing for OSCE exam. And if you have any comments at all, pop it up. I'm happy to read your comments. Okay, guys? So let's get started. Now, guys, for ectopic pregnancy in your OSCE exam, I will advise you read your instruction very well. Just because we've had a lot of scenario where you don't read your instruction and you go and plan prior to surgery, perhaps the instruction is telling you to plan post-operatively. So you can either plan pre is before the patient goes for surgery, or you can either plan post when the patient is out of the surgery. Okay, guys, so just read your instruction very well and know the one that wants you to plan either pre or post. Now, if it's pre, guys, you know the common care plan. A patient who has ectopic pregnancy, of course, is in pain, severe pains. And during your interaction, you have to ask the pain score. So Mr. A is my patient. Let's assume and let's go ahead. So Mr. A is experiencing pain with a pain score of 7/10 due to ectopic pregnancy. Don't forget, I'm planning out parallel to the surgery. Simple. Somebody else will say, it's so easy. What about the second one? Mr. A is for exploratory laparotomy and needs a safe preparation. It's that simple. Aim of care. Aim of care is patient feels safely prepared for theater. It's that simple, guys. And number 3, anxiety. Mr. A is anxious because of unknown outcome of surgery. You know, it's that simple. Those are the likely care plan you may want to consider pre. And what about post? If you're asked to plan for post, and don't forget, it's only 2 care plan you do in your OSCE exam. If you're asked to plan for post, of course, you consider pains. The patient is out of the theater, and the patient will be having pain. That's constant. Of course, you'll be considering risks for infection, because of the incision site, definitely, there'll be a risk for infection. There'll also be risks for hemorrhage because also of the incision site. So guys, it's so simple, really simple. So let's get started. For the sake of this video, I'm going to be planning for post. So assume my instruction is what? Is post. Number 1 care plan. Mr. A is experiencing pain from incision sites. Full stop. But you know, we nurses were so brilliant and we are so intelligent. So those that are very, you know now, nurses now, you know us now, we are so intelligent. Those that like speaking English, they will say, Mr. A is experiencing pain from incision sites following exploratory laparotomy. Whichever you choose is perfect. What is the aim of care? Patient verbalize ease of pain. What is the reevaluation date? To be reevaluated today, every hour, and as the clinical condition changes, because obviously you know it's pain, so you have to really reevaluate as quickly as possible. So now let's borrow our Immatarid. Somebody will say, what is Immatarid? Go watch my video on Immatarid. It makes your care plan super easy. Now E, explain and discuss all aspects of care to Mr. A and gain consent. M, monitor and record Mr. A vital signs or Mr. A observation every 15 minutes for 1 hour, every 30 minutes for another 1 hour, and hourly for the next 4 hours, and escalate as per news 2 policy. Tick. You know, it's that simple. And A patient is in pain. What are you assessing for? Assess for pain using the pain assessment tool. The pain assessment tool is like a scoring tool, you know, to know the scale of pain. So assess for pain using the pain assessment tool. That's all. EMA. The next thing is teach. A patient who just came out of theater or post-operative, what do you teach? You teach deep breathing exercise. You teach adequate positioning for comfort. You know, it's that simple. And the next one is A, administer all prescribed medication, and you have to monitor its effectiveness after 30 minutes. And after that is R, who are we referring the patient? We will refer this patient to the pain assessment team and the surgical team, because obviously this is a patient who has done surgery. It's that simple, guys, you know. And the next one is what? I, you inform patient to use the call bell. And the next one is D, document all care plan. Guys, whichever care plan they give you, whichever scenario, is really simple using Imatari. It's really, really simple. And somebody will say, self-care by the patient. Patient verbalizes understanding of the treatment plan. Patient participates in a plan of care. Patient is able to use the call bell. Patient consents to treatment. Patient is able to do deep breathing exercises and adequate positioning to promote comfort. Patients tolerate all medications administered. That's simple. That's it. Now, my second care plan, because I told you assume I'm planning post-operatively, that's my instruction. My second care plan is going to be risks for hemorrhage related to surgery. Yeah, or risks for hemorrhage related to exploratory laparotomy. It's that simple, guys. Guys, it's that simple. Honestly, it's really, 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 really simple. And so, what will be my aim of care? Aim of care, patients will not experience any sign of hemorrhage or any sign of bleeding. Re-evaluation dates to be evaluated today, every hour, and as the clinical condition changes. Guys, it's that simple. Now, borrow Imatari, explain and discuss all aspects of care to patient and gain consent. It's that simple, right? Monitor and record patient observation every 15 minutes for 1 hour, 30 minutes for another hour, and hourly for the next 4 hours. A, what do you assess? Assess for any signs of bleeding from incision sites. Assess post-operative sites for any signs of bleeding and apply firm dressing using ANTT. Okay, guys, assess for any sign of post-operative bleeding and apply a firm dressing using what? ANTT. So assess for signs of bleeding. That's what you assess for. And when you're done with your assessing, you teach. What are you teaching the patient? You're teaching patient deep breathing exercise. You're teaching patient adequate positioning to promote comfort. Then A, administer all prescribed medication, monitor its effectiveness after 30 minutes. Arrow, this is a patient that is, you know, there's risks for bleeding, obviously. So you have to refer this patient to the surgical team. Yes, you have to refer this patient to the surgical team. And I, you have to inform patient to use the call bell. And D, you have to document all care as plan. Is that simple? Aim of care. Mr. A verbalizes understanding of the treatment plan. Mr. A participates in his plan of care. Mr. A consents to treatment. Mr. A is able to use the call bell. Mr. A is able to take his drug. Mr. A understands reason for referral. Whichever, whether it's Mr. or Mrs., whichever, it just falls in place. And somebody else will say, what else? There's risks for infection. It's just 2 care plan you do, guys, in your OSCE. I'm just trying to elaborate it so that we can understand this. There's risks for infection. Risks for infection following exploratory laparotomy. The aim of care is there will be no sign, or patients will not experience any sign of infection. Re-evaluation date to be evaluated today, every hour, and as the clinical condition changes. E, explain and discuss all aspects of care to patients and gain consent. Monitor patient observation every 15 minutes for 1 hour, 30 minutes for another hour, hourly for the next 4 hours. What are you assessing? Assess for any signs of infection, e.g. pain, odor. You know, there's foul smelling odor, redness. So these are all the things you do what? You assess for, even swelling, pus. you know, because you're obviously suspecting there's risk for infection. So you're assessing for pain, assessing for redness, assessing for swelling, assessing for pus formation, assessing for foul smell. You know, after you teach the same thing, deep breathing exercise and adequate positioning to promote comfort. You know, guys, it's really so simple. And if you're referring for infection, you are referring to you are referring to the surgical team. You could even refer to tissue viability team, whichever. Is really that simple, guys. So don't crack your head too much. These are the care plan for ectopic pregnancy post-operatively. And I told you for pre-operatively, patient is for exploratory laparotomy and requires a safe preparation for theater. After you explain, monitor vital sign, then you assess. What are you assessing for? Assess and ensure consent form is signed and all pre-operative checklists are completed, you know, and you just borrow the rest. That's all. It's really that simple. Please, guys, thank you so much for your support. And before I go, guys, I'm happy. I got a lot of emails. I passed my OSCE, I passed my OSCE, I passed my OSCE. Wow. Nurses are really intelligent. So congrats to all the newly band 5. I can't wait for you guys to begin to go to band 6. Bless you. Thank you so much. And if you are preparing for your OSCE exam, please don't be scared. It's really very simple. Just prepare and go come with good testimony. So guys, I will see you in my next video on care plan for congestive cardiac failure. Until then, keep passing your OSCE. Bye, guys.